Hi, I'm Chris Woodland, respiratory therapist and director of respiratory for South Medic. And today I want to tell you about a new innovative product we're distributing in Canada, the NeVAP Secure-Swap endotracheal tube device. Designed for ICU and other critical care environments, the Secure-Swap provides advanced securement for orally intubated patients, replacing traditional taping methods and other problematic securement devices with a comfortable, adjustable interface that protects skin integrity and simplifies tube repositioning. Secure-Swap's air-inflated see-through cheek pads disperse pressure evenly, preventing device-related pressure injuries and allowing clinicians to keep a closer watch on their patients' facial skin integrity. Less use of adhesive on skin means less chance of skin breakdown, and the open design of the Secure-Swap cheek pads allows both heat and moisture to be vented away from the skin, also assisting skin integrity measures but also promoting comfort and compliance. The adjustable track on the Secure-Swap frame makes it easy to reposition the endotracheal tube when using one of the attachments to secure the tube with. These come with or without a bite block option or with a tube holder to support stability of the tube. These modular attachments increase the flexibility of using Secure-Swap. If you want to change one of the attachments because of patient need or if they become soiled, simply swap out the attachment and replace it with a new one. No need to replace the entire device, saving time, cost, and waste. And whatever attachment you decide on, the adjustable track makes it easy to reposition the tube to relieve pressure points during long-term ventilation. So why don't we try to show you how to place Secure-Swap on your patient? Simply take the frame, Secure-Swap F for frame, remove the cheek pad adhesive covering, making sure that the frame wings are in the thumbs up position. Spread the wings slightly and place Secure-Swap gently on the patient's cheeks while someone holds the tube. Make sure the adjustable track is centered over the patient's upper lip. Take the strap underneath the neck and secure it through the frame's loop. Unlike other securement devices, because the air-filled cheek pads help disperse pressure on the skin, you can create a snugger fit with the strap as needed, making both the strap and the cheek pad adhesive ways to secure the tube, not just with a hard hydrocolloid cheek block like other tube holders. Once the frame is in place, decide on which modular attachment is best for the patient. Secure-Swap A is the universal tube securement option, or Secure-Swap B for bite block includes the bite block option, and thread either one onto the adjustable track from the patient's right side. Note here, you can't slide any of these attachments right off the track on the other side because of a stop preventing exit of the attachment as a safety measure. Position the attachment on the track lined up with the tube, remove the adhesive covering here, wrap the zip tie portion around the tube, allowing the tube to bite into the attachment's teeth structure for security, and clip the zip tie in place with the tab so it stays secure. And you're done. No tape. Adjust the tube position along the track with a simple pinch of the attachment according to the frequency dictated by your hospital's protocols, and as mentioned, you can swap out any of the attachments as needed without having to replace the entire device, keeping the patient safer, more comfortable, and saving clinicians time and costs. If desired, you can even place a second attachment A on the adjustable track in order to secure the patient's NG tube without having to tape it to the endotracheal tube. Simply invert attachment A on the track, place appropriately, and secure the NG tube in the same way. With Secure-Swap by NeVAP, distributed in Canada by South Medic, you've got a smarter, safer way to secure your patient's critical airway needs that focuses on their care, helping preserve their skin integrity by preventing device-related pressure injuries without interrupting ventilation or stability. Give it a try, and we'll see you next time.